So I'm Sherry Meyerson. I'm a general thoracic surgeon, and I'm the program director of cardiothoracic surgery here at the University of Kentucky. We do have two programs here. We have an integrated thoracic program, which people will match to out of medical school. That's a standard 6-year program. The program here at Kentucky is really unique in its emphasis on basic skills simulation as well as graded autonomy in the operating room. We want you to be able to make the correct decisions about the patients, get them to the operating room safely, get them through the operation safely, and then not only deal with the normal post-operative course, but recognize and manage the unexpected.
You want a dynamic place to be. There's never a dull moment. We're working 24/7, 365. Every day is kind of an adventure.
I had no general surgery background, and I had a medicine background. The last 3.5 years or whatever of training here has been interesting, just learning the surgical side of things. For me, this was the place. Like I needed somewhere that was going to give me a really good foundation in general surgery and cardiothoracic surgery, and I feel like I have that here. I wanted somewhere that was focused with clinical work and patient care, and that we see more patients here than I can imagine.
So the first 3 years of an integrated program are really key to developing basic skills, and one of our true premises is that you are part of our program from day one. That means you come to our conferences, you do our readings, you are immersed in cardiac and thoracic from the moment you start in the program.
I think one of the things that the program here does really well is that there's autonomy, but it's not autonomy that's given to you up front. You have to earn that. And so you earn it by being prepared every day, showing up to the OR, knowing what the case is and how you're going to do it. And if you can do that and demonstrate that you're there to learn and take it seriously, then the autonomy will come pretty quickly.
This is now going on our 3rd year here, and we couldn't ask for a better place to live. I live about 5 to 7 minutes away from the hospital, and I still have a yard that my dog and child can play in.
I like to be outdoors. That's kind of where I spend most of my time if I'm not in the hospital. And around here there's really awesome hiking, and there's like great trips to take that's even just like local to the area, and so that's been a good outlet for me.
You're not going to struggle to get caseload. You're not going to struggle to learn. You'll have enough clinical exposure to finish where you want to finish.
I don't feel like that there's anything I'm missing, and I think that when I leave here I'm going to be a really safe surgeon, and I'm going to have great relationships with my patients, and that's what mattered to me.
People who leave our program really have the opportunity to do what they envision of their career.
It's small faculty. We know each other pretty well, and we get to know our residents pretty well. You know, that has its ups and downs. There's no place to hide for sure, but on the other hand, we know you personally, and you've got our support even in bad times. You know, we may correct you in the operating room or on rounds or something, but we're not malicious. We'll take care of you. I can't imagine a better place to learn.